In this video, I'll be discussing the inaccessibility of medicines in low and middle income countries and why that is. With all these questions, one thing does hold true regardless of caveats. In low and middle income countries, many medicines are either inaccessible or often regarded as substandard. Today we're unpacking a critical issue that touches nearly 2 billion people around the world. That's right, 2 billion. These folks have little to no access to essential medicines, impacting their health, their families, and their communities. In places like Kenya, Uganda, and Tanzania, accessing basic healthcare can be a real challenge. This isn't just about convenience, it's about life and death. So what's going on? Let's dig into the realities on the ground, the implications for those living this every day, and some innovative solutions being tried out. Over 30% of the world's population does not have regular access to essential medicines. Over half of Africa's population lacks access. Nearly a quarter of the world's population doesn't have access to essential healthcare services. And when we say essential medicines, we're talking about life-saving stuff. Antibiotics, antimalarials, insulin, and much more. First off, we need to look at the distinction between essential and non-essential medicines. Essential medicines are drugs that meet the basic healthcare needs of the population. They're supposed to be available within the functioning healthcare systems at all times. But here is a twist. A lot of the markets in low and middle income countries lean towards non-essential medicines. This deprioritizes life-saving products for potentially higher profit margins. This skew can lead regulators to devote more resources to non-essential products and leave essential medicines in a bit of a bind. Many of the drugs on the essential medicines list are out of patent, and generic medications can therefore be produced locally. So, looking at the scope of the problem, let's see how much is manufactured at the local level. A recent study conducted by the University of Newcastle looked at 19 companies in East Africa, 9 companies in Kenya, 4 in Tanzania, and 6 in Uganda. Most local medicines were non-essential medicines. Of the 946 locally produced products in Kenya, only 310 were essential medicine products. Of the 97 locally produced products in Tanzania, only 39 were essential medicine products. And of the 181 locally produced products in Uganda, only 100 were essential medicine products. Many local essential medicine products were duplicates. Only a small proportion of essential medicines were produced locally, 21% in Kenya, 5% in Tanzania, 10% in Uganda. Kenya, Tanzania, and Uganda had no local essential medicine products in a number of therapeutic classes. The proportion of essential medicines that were registered varied across countries. But the East African community may have a solution. Reducing reliance on pharmaceutical imports from outside the East African community by 20% promotes the expansion of product portfolios to meet the needs of over 90% of diseases. And having at least 5 companies that manufacture advanced pharmaceutical formulations such as sustained release tablets, immune sera, layered tablets, and vaccines. In East Africa, the struggle is real, just like many other low and middle income countries. Infrastructure challenges, economic barriers, and even corruption can turn a simple act of getting medication into a daunting task. Much of this topic has many other mitigating factors, and I shall be exploring them with you in time.